triggered by acute respiratory infections. Previous studies have suggested an association between influenza and acute myocardial infarction, but those studies use non-specific measures of influenza infection.
About 45 minutes. And this is the EKG that is done in the field. You quickly review it. And you notice that there is a report from the field of a ST segment depression here in the precordial leads. Now, this was done about 10 minutes ago. The patient is quickly moved into another room and an EKG is done. And here is the EKG that you get. Let's go through our evaluation as we go through this. Remember our 5-step process here. The first thing that we want to look at is rate. We can pick
Application and nursing.
To evaluate the association between laboratory confirmed influenza infection and hospitalization for acute myocardial infarction, they use self-controlled case series design. Various high-specificity laboratory methods to confirm influenza infection in respiratory specimens and ascertain hospitalization for acute myocardial infarction from administrative data.
In the labs. So think if ST is high, then the heart muscles have died. And if ST is low, we always think low O2. Now this is called ST depression or T-wave inversion, again caused by that low O2, aka ischemia, meaning only partial blockage, or it could be from hypokalemia. And typically ST segments will go back to normal when we get reperfusion. So we confirm it with blood labs. Guys, write this down. Troponin is our #1 indicator for MI. It's our gold standard. So again, write it down. Troponin over 0.5 indicates trauma to the heart. As heart muscles die, this protein leaks out into the blood, along with potassium. So patients will also have high potassium, aka hyperkalemia. But our other labs like CK,
Pros and cons. Pros: confirm the association with the influenza and the acute myocardial infarction because injury. Cons: the result may apply only to respiratory infections that are of the sufficient severity to the results in laboratory testing.
Echocardiography plays a valuable clinical role in patients with known or suspected acute myocardial infarction. It can be used to help establish the diagnosis when a regional wall motion abnormality is identified. The majority of clinical decision-making is based on visual analysis of regional wall motion. Development of a regional wall motion abnormality requires involvement of a critical mass of myocardium. Myocardial infarction below that threshold, as can be documented by sensitive enzymatic assays studying ventricular mechanics, such as strain and strain rate, have shown increasing promise for detecting lesser degrees of ischemia or infarction. Echocardiography can provide prognostic information and also is accurate for the diagnosis of virtually all mechanical complications of myocardial infarction.
Issues of line in Ecuador. It is worth mentioning that in the United States happen 1 million strokes per year. The incidence of acute myocardial infarction may be close to 40,000 people a year, which means that every 12 minutes an Ecuadorian suffers a heart attack.
Acute myocardial infarction is acute closure of the coronary artery, which is related to either rupture of the plaque, leading to acute onset of thrombus formation and sudden arrest of blood supply to that area, which is defined as majority of the time you will have chest pain, but there are certain variables like advanced age, diabetes, they may not have chest pain. Atypical symptoms, which may be a variable from the normal chest pain and can mimic different conditions. Aortic stenosis usually presents in two forms. Either it can present because of the degenerative aortic valve disease from advanced age, or it can present from congenitally malformed aortic valve. Usually it's a tricuspid valve. If you have bicuspid valve, it's more prone to degeneration faster, and they present a little bit earlier part of their age, of their life, with aortic stenosis. So patients with mitral stenosis, they usually have underlying history of mitral stenosis, especially have underlying history of rheumatic heart disease. So more commonly seen, which has become less and less. And other conditions for mitral stenosis are very rare to happen.
Conclusion. In this study, in which they use specific definitions of the exposure and outcomes in a self-controlled design, they found a significant association between acute respiratory infection, particularly influenza, and acute myocardial infarction.
Hola.
With an atherosclerosis plaque, which has developed over the years. Thrombosis occurs following a sudden rupture of this plaque. A clot of blood has blocked the coronary artery. It prevents blood and oxygen from reaching the part of the heart irrigated by this artery. This part of the heart, already injured, risks being completely destroyed without immediate